Baltimore. It's Dr. Jeff Kalkstein with Kalkstein Chiropractic, your Baltimore area chiropractor. And I'm with Jennifer today. This is Jennifer, you were new yesterday, correct?
Correct.
Yep. And who referred you to us?
Dr. Stephanie Rhodes.
Stephanie Rhodes. And she sent you here because you were experiencing what?
Lower back pain, mid back pain, chronically.
Yeah, we're not going to give any secrets away, but Stephanie is a midwife?
Certified nurse midwife, correct?
Midwife, yes. So, and Stephanie, when she was close by, I'd have 2 women a week that were pregnant, right? Like every week they show up. Who sent you? Stephanie. Because people who are pregnant get back pain and they can't take a lot of drugs or medication, so she liked the natural approach. And I think what she really liked was she liked the results, right? What did she say when you came up? She would trust you with what?
She would trust me, well, becoming pregnant, but she said he got me through my 3 pregnancies, and she definitely speaks highly of you.
So it was back pain she sent you to us. Yes. How long have you had it for?
2 years.
2 years. Pretty much daily?
Yes.
Okay. And on a scale of 0 to 10, 0 is no pain, 2, 3 mild, 5 moderate, 8 gets into the range where you're thinking about not going to work, right? So what was your level on average during the course of the day?
It was 6 to 10.
6 to 10. Have difficulty sleeping?
Definitely.
Yep. So she came. Jennifer came in yesterday. We examined her and we did dry needling. Right? Yep. Adjusted you. And so, how did you feel when you left here?
Immediately, I felt like I was on clouds. I think that's exactly what I had told you.
Yeah. Felt lighter.
I felt lighter. Didn't know if that was going to be a temporary sensation, but it carried on through the day. Immediately noticed that I did not feel as much discomfort in my lower back as I have for
when you walked in.
And when I walked in, yes.
Yeah. And how was sleeping? I know sleeping was rough for you, right?
It's always rough for me. Noticeable difference in the first night.
Yeah. And so here we are the next day. So she came right back in because she was in so much pain. And we dry needled. We also showed you some exercises.
Yes.
Where you're standing up, bending backwards. Right. So we use different tools. One of those is dry needling. So the other one is a protocol called McKenzie, and we use it for low back and neck and shoulders. And we just started that. And then what we'll do is, once she feels a little better, we'll start her on what we call a stabilization or a core strengthening program, right? Yeah, yeah. So one of the things we did the other day, let's just do this real quick, because I haven't adjusted Jennifer yet. So come on over here for me, please.
Sure.
So what side hurts the most?
The right side.
The right side, yeah. So let's have you leaning away from that side, lean this way. So a little bit of left lateral bending. You feel that? Yeah.
And I felt a little crunch.
Now go back over to the opposite side. Yeah. Is that still uncomfortable too?
Further down, but not as much.
Not as much. So what I've noticed right now is you're able to move a little bit better than you were yesterday. Now do this for me. Bend back over my fingertip, straight on back. Yeah. Does that bother you at all?
As I go back further, yes, lower back.
And then relax right there. Does that bother you? What side does that hurt on? The left side or the right side? Or right in the middle?
Right in the middle.
Right in the middle. Now come back this way. And how about that side?
More on the right side.
Yeah, that's the way it was yesterday. Let's see you touch your toes for us. Yeah, so that's pretty good. Come on back up for me, all right? So let's have you lie with your right side down, and you'll face Lee right there, okay? All right, you can lean straight in for me, okay? Good, and I'll just take that hand out with me. Were you doing any exercises before your back started to bother you?
Yes. On the elliptical daily, walking dog daily.
And has the back pain interfered with that activity?
It causes me pain, so I just stop.
Stop.
Yeah.
Okay. So let the shoulder nice and loose. Okay. Now. So I want you to let this all loose for me. I'm going to tap her on her hip just to get her to distract her. Very nice. Good job. Let's have you roll to your back for me, please.
Okay.
And then straighten your legs out. I'll help you out. So now let's have you turn towards me, Jennifer, please. And then right back down. So, as you all know by now, I'm trying to get some motion back into her lumbar facet joints. the hinges that allow movement to occur in her back that are innervated by sensory nerves, right? So I'm going to push you away from me. So, Jennifer, right there is good. That's perfect. Thank you. Again, just be comfortable. Yeah, let me have this hand for a second. I'm going to pull that shoulder up. There you go. So I want you to bring your chin towards your chest a little bit. Yeah, that's right. Let this loose for me. Let that drop. Oh, that was really good. That was perfect. On your back for me now. And the other thing I'm going to do for Jennifer is I'm going to adjust her hips, okay? So if you relax for me. Oh, yeah, there you go. Now pull yourself up towards the windows, Jennifer, away from me, please.
Okay.
Push up. There you go. Perfect, perfect. I'm going to straighten your legs out. Let that nice and loose. There you go. All right. So let's stand back up and see if that helped the movement a little bit, okay? So going back to the backward bending exercises before we check this, you could do those every couple hours right now, right? And I think the other thing that's really important for you is when you're sitting at work, you want to sit back into your chair. You want to have good posture where you feel like your belly button's coming out a little bit and you're sitting like this, okay? So now let's have you lean this way for me, all the way over. Yeah. Does that pinch at the very end?
At the very end.
Yeah. Does it feel different?
Yeah.
Yeah, now go back. Yeah, now go back to this side. It's going to really feel better because I really look at that. That's pretty good. I don't know if you can tell the difference over there, but that's significantly different, right? Less pain, right?
Definitely.
Now,
let's go back down further.
Down further.
Front this time.
Yeah, and I can tell. I'm looking at her face to see her pain reaction, and she was pretty comfortable. And even that's much better too. Isn't that nice?
Yeah.
Yeah. Yeah. So this is her second visit. Anything else you want to share with Baltimore?
I'm really happy. I'm gonna keep coming back.
Yeah. So I think what we're going to do is we're going to put out the fire, decrease the pain, and then when you're ready for it, we're going to start to strengthen you. Right. We're going to start to get some. We're going to get the muscles to respond the way they should respond to protect you. Okay. All right.
Sounds good.
Good. Thanks, Baltimore.
Thank you.